what we want to do today is have a little bit of a discussion with the faculty. Think of a question or two. It's always fun to try to draw connections between the talks, so if you can think of anything like that, well, let's have some fun. This was just an amazing group of faculty here in these talks, weren't they, everybody? This is my first Saturday U as well. So I want to thank you all for coming. My name is Shannon Smith, and I am the new director for the Wyoming Humanities Council, and we are a sponsor of Saturday U. And for those of you who don't know, we're what the National Endowment for the Humanities does. They send money to every single state, and we all have state humanities councils, and we distribute those funds through programs like this. So when you hear anybody questioning why do we need a National Endowment for the Humanities, you are sitting here experiencing the reason we have this. And so please help us spread the word. Please help with your representatives, if you know, and speak with our U.S. delegation, let them know and say thank you for providing this kind of opportunity. And also thank your state representatives, because we are one of the lucky states where we do get funding from our state legislature. And that's a big deal for a state like this, and we should really be proud of that. And then additionally, we do fundraising, and so what we like to say is that for every dollar that the state gives us, it's matched by federal money and money from any kind of donors that we get. And it brings programming like this to communities throughout the state. We touch every single community in a 2-year period of time. All 99 organized communities in the state of Wyoming get a program from the Wyoming Humanities Council. So I wanted you all to know a little bit about that. A few of the ladies over at this table found the newcomers guide, which we have some more out in that table that was in the lecture hall. Feel free to grab. If you know folks that are new to Wyoming, or if you want to get a grin and read this, what this is a great guide to explain our unique culture, our unique atmosphere in this state. And it's a wonderful tool. It's a wonderful publication from the Wyoming Humanities Council that's been around. It's in its 3rd printing since 2009. So anyway, I'd like for you all to now start thinking about questions to ask. And Peter's up at the front, so he'll kind of help moderate. But let's all just continue to enjoy our meals and chat with our faculty.
Great, so I'll moderate if there's questions, and if you can't hear somebody's questions, just shout out at me and I'll repeat it for the whole room. So we'll take questions if you'd like to make a comment or ask a question of one of our speakers.
Well, I'd be interested in hearing Ann's thoughts. In my mind, the problem with the healthcare industry is insurance has created an artificial marketplace. Like we talked when the one gal asked, well, why don't we address the charge master? I mean, I'm an attorney, and I know that I deal directly with my client, and I negotiate the price, and I have to develop a reputation, be good, and that person pays me the bill. It makes me more accountable to them, and it makes the price honest. And in my mind, and that's most businesses like that. You know, most industries are like that. It seems to me that the healthcare industry is a little unique, although I see insurance distort, like after we have hail damage, and it just seems to me that insurance companies distort, you know, the way the economic system is supposed to work, where 2 people negotiate directly and charge a fair price, and I pay the price. And I mean, I'd be interested. It seems to me we either have to remove insurance out of the picture altogether, and doctors just go out and compete for business and charge and get paid directly from a person, or it has to be a nationalized system, because what we have is an artificial economic system, it seems to me.
When I'm talking about health insurance, I always, I mean, what you just said, health insurance is kind of, you know, it's not quite the same as any other market. Health insurance is not the same as any other insurance product. Most insurance is catastrophic, right? You have an auto accident, you have your house gets blown away by a tornado, and the insurance is there for a bad thing. You die, you know, your heirs get life insurance. Health insurance is for just this whole other set of stuff. Preventative care, catastrophic care, chronic pain care. so it's got all these other characteristics that make it like no other kind of insurance. And health is not like any other, or the market for health care provision is not like any other market, because it's not a simple formula where if there's competition among doctors, their prices come down. Because we have this other entity that is inserted in between you and your doctor, which is the insurance company. Unless you are uninsured, in which case there is some negotiation that's possible. But, I mean, you know, I think the charge master is kind of the ultimate weird thing, because it's the highest price for the lowest income, or the person who's least able to pay it, I guess is kind of how you would say it. And hospitals know that, and doctors know that, and they end up negotiating down the price anyway. Or if they don't, people go bankrupt. But in most cases, there's some room for charity care and write-off of debt and things like that. But so it is not like, you know, when I teach principles of economics or any of my other econ classes, there's the L with the big X, right? The price and quantity and supply and demand, and there's the market price. And there's no way in hell I could ever describe anything about healthcare in that graph, or even, you know, a different kind of market graph. The market is just so different. And it is because health insurance is so different from every other kind of insurance.
You could create that formula, but for insurance, could you not? I mean, when you say, because doctors would all, just like any other professional, they would establish kind of what a going rate was, and not have insurance companies say, this is what we'll pay.
Right, that's how it used to be until we had the Blue Cross Blue Shield and then commercial insurance model. So it's a different animal altogether, and so, you know, other kinds of insurance have existed for a long time. You know, commercial insurance for transatlantic ships, so yeah, of slaves and cotton and all sorts of other things. None of them are even remotely like this. It wasn't until this sort of idea of, well, let's collectively treat a set of people as one pool, and we'll put a bunch of money. I mean, the idea was nice. You put a bunch of money in a pot, and you draw it out as you need to make sure the doctors get paid, or the hospitals. That makes a lot of sense until it starts just going crazy with all this patchwork stuff that happens.
I'm diabetic and I take insulin. And I remember one time I went and asked the pharmacist what a vial of insulin would cost me if I didn't have insurance. And they looked at me and they couldn't give me an answer. He looked at me like he couldn't even conceive of the concept of telling me what that product cost, as him, the seller, and me, the buyer, because he didn't have an insurance company telling him what that vial of insulin would cost. And that's ridiculous.
A couple weeks ago, we had Stephen Brill, who wrote that article I was talking about, the bitter pill in time. He was at UW, and I got to interview him for the audience. And I mean, the way we started it out was I gave the analogy of, imagine you're going to drive to, you know, these were Laramie folks, and I said, imagine you're going to drive to Gillette, you got to go get some gas. You go to the gas station, you can find nowhere at the gas station what the price of the gas is. You look up and down the street, there's no posted prices for the gas. You say, okay, well, I got to get gas because I'm going to Gillette. I'll run out of gas if I don't top off here. You put the gas in the tank, you pull out, you walk up to the window, and the guy says, okay, so how much do you owe me? Let's see. Does your employer have a relationship with my petroleum supplier? And you go, what? And he said, okay, well, how much money do you make? Are you really poor? Okay, I don't know how to answer this. How old are you? Are you over 65? And why are you asking me all these questions? Because how much he's going to charge me is going to depend on my answer to those questions. If my employer has a relationship with the petroleum company, he'll charge me $8. If I make $13 an hour, he's going to charge me, you know, 50 cents. If I'm over 65, he's going to charge me $4. And if I'm none of those things, he's going to charge me $800. I mean, what? None of it makes sense, right? We would not accept that at a gas station.
Anymore, doctors only choose to give services to people who have insurance. That's, you know, everybody complains about Obamacare, but the reality of the situation, because doctors are used to getting paid by insurance companies, And that makes it a heck of a lot easier to just deal with an insurance company and know that you're going to get paid rather than other people who have to, get money from an individual or go collect from an individual. A lot of doctors will not see a person who does not have insurance.
Well, a lot of it.
They ask the first question. I've done it, it's happened to me half a dozen times here. I call to schedule an appointment. The first question is not, what is wrong with you? It is, do you have insurance? And when I said, what does that have to do with anything, because I did have insurance, but I said, I can afford to pay you. They would not give me an appointment without me telling them, assuring them that I had insurance. And
You need to bring Thor with you the next time.
The original character who became Thor in the comic books, Don Blake, was a doctor. And there's one episode of the one Avengers comic where this villain kills all the Avengers except for Thor, and then a sympathetic character restores them all to life just barely, and then Don Blake he turns from Thor back into his doctor self and goes and he saves them all.
This is beautiful.
Thor and Health and Human Services, and then we could solve this problem.
Oh my gosh, that's all right. With all of our programs now, it seems to me, we just got to start from scratch and do the Moneyball thing. We need to sit down and say, what do we need to have? What do we expect our government to do for the citizens? And what should they not do? And how do we pay for it? And what size should it be? And because it's not just the health system that's in a patchwork, it's everything right now.
And you're saying that you don't see the Affordable Care Act really structurally tackling spiraling costs. Maybe this is a political scientist question, but why do you think that is? This major push in healthcare reform isn't, in your estimation, doing much to take on that bigger structural issue of costs?
I think a lot of it comes down to it's difficult to tackle. We have drug costs. It's a great example. That's one of the drivers of our very high healthcare costs. And a lot of money is poured into doing the research for those. How do you fairly get that money back? How do you protect the creators of it without harming potential, people who can benefit from the medication and can't afford it? It's just this big dance that everybody has to do, and then there are the procedure questions. Why are they so expensive? It's the same thing. A lot of it comes back to the cost of medical research. We spend more in this country on medical research than anyone else. And to be fair, and for it to continue, we have to find ways for those people to be compensated for what they do. And often that's through giving them a patent for that procedure or for that medical device or for that drug. And that's as it should be, but then you start putting these things back into the midst of time charge master, and nobody knows where the price came from, and nobody knows if it should drop, and nobody knows if it's the right price because nobody's ever looked at it. So it's kind of a midst of time problem combined with we really do have the greatest medical research in the world, and people really do have to be compensated for doing it. So how do we do that and balance that with patients' needs? And I'm not a political scientist, so I can't tell you how to do that. I mean, one piece of the legislation that was an interesting thing was figuring out how to, so the insurance companies were getting something that they were happy with, but part of the skin they had to give up was they had to reduce the amount that they were able to recover in overhead and administrative costs. So they can't have more than, I think it's 10% of their premiums going towards administrative costs, so 5%. And if you do, they get a big giant fine. And so that was one area where they tackled it, but I don't think that you just don't attack the drug companies. I think if you're a politician, you want to get reelected. But again, as I said, if these folks are just plowing millions of dollars into this research, they have to be compensated for it. They're not in a public service nonprofit business, they're companies.
They're not doing it for the benefit. They're a business, right? And they write off all their R&D. So they get that benefit from the federal government through saved taxes. So they are compensated for all their R&D. That's not
They get tax breaks, that's true. Yeah.
Well, there's another issue too, which is prevention, which we haven't seen yet. That's going to be a huge thing to look at over the next 20 years to see if
That would be a
an
definite
investment in prevention is going to be good
Yeah.
on the other end. And
Yeah.
I think that a lot of insurance companies now are really emphasizing prevention. We're doing it in the school district here. The big coal companies, energy companies,
Yeah.
oil and gas are all doing it with their
Wellness
self-insured
programs,
status.
yeah.
And so I think it's going to be huge.
Yeah. And I
20
think
years
you're
down
right.
the road, we'll be
I
able
think
to
you're
see
right.
if that investment is working.
That's one of those things that everybody has always posited was having a big effect on costs, because if you were uninsured, you wouldn't get preventative care. And so small things would balloon into very expensive emergency room visits that would then not be collectible at all. And so that's going to be really interesting to see if that's, I think it will bring down costs, but you're right, it'll be 20 years before we know probably.
I haven't seen the data, but my husband's retired IBM, and they went to exchange. But they capped their medical costs in 1990, but they've been doing preventative medicine since our children were born in 1981. So they have really healthy lives, and they don't smoke, and all of the, so I think preventative in the long run will work. I don't know any statistics on it, but I know in our family it made a huge difference about their health with all the preventative.
Yeah, and you saw this trend in the past 12 years or so where companies are doing that on a lot larger scale. So they're promoting wellness programs. They're giving you discounts on your insurance policies. I mean, they did that for us for a couple of years. Trader Joe's was a place that did that too. They had a big emphasis on that, and you could get wage increases, you could get, so you could get raises, you could get premium discounts, you could get all sorts of things if you participated in an actual wellness program where you were going to the gym and doing some other things. So.
This is the first time I've understood about that gap from 100 to 133% there. Yeah, are there any solutions floating out there about how to fix that?
No. It just wasn't well thought out. The case when it went to the Supreme Court, everybody just thought it's going to be all or nothing. It's all going to be constitutional or it's all not. And when they came back, they said, okay, all of this over here is unconstitutional, but you can't force the states to do the Medicaid expansion because they may not want to take on the extra cost. And that just threw everybody for a loop because there was this, they had structured it so the subsidies go down to 133, Medicaid goes up to here, and there's, goes up to 133, and everybody's covered by something. But if you're in any state that doesn't have a Medicaid expansion, Medicaid's still down here at 100%, the subsidies to 130, and you're here, at 125% of federal poverty level, and you probably still can't afford the premium without some subsidy. But, there are all sorts of crazy things about this. Like the subsidy also is kind of a source of concern, like how much that's going to cost and where the money's going to come from. They're saying they're going to fund that from the fines from people who don't buy insurance. CBO estimated that they should be able to cover it, and I trust the Congressional Budget Office greatly on their estimates. But, so there's all sorts of, crazy things in that little gap. So the answer is we're still going to have some uninsured, and they're probably going to be the people that we really want to be insured too. So, young, healthy, just starting out in their jobs,
I have one question. I'm originally from Canada, so I have a different background in terms of health, obviously, and medical things. America, I'm an American citizen, but America sort of promotes entrepreneurial spirit and independence and this kind of thing. But yet, by not having universal health care, and this I am not able to understand in my mind, by us as a country not having universal health care, we promote people not having their own businesses, not going out on their own, not being entrepreneurs. We promote people working for huge corporations or governments or something because you stand to risk everything you've done if you have a catastrophic health. Even if you have some unaffordable health insurance, like self-employed like I have, it doesn't make sense with the American spirit.
There was actually a really good study that was done by a couple of folks at Harvard Business School last year that looked at, estimated essentially how much entrepreneurial activity is lost annually in the U.S. because people are, even just opening small businesses that are not necessarily like cutting edge technology or something, but And they've estimated that probably on the order of about 2 to 3% in growth has been lost in new business formation because of people's aversion to having no health insurance. And I know anecdotally from a lot of people, I teach in a business school, so I know kids who have done that, who have gone to work for a corporation rather than going out on their own because they're afraid to incur a catastrophic health insurance or health cost. And last year, actually, I was thinking about buying the Fishtail General Store in Fishtail, Montana. I'm not kidding. I love that place. The Stillwater Mine is right up the road. They stop every day. They get breakfast burritos and pies and all this. And I'm like, this is like the steadiest source of money I have ever seen in my entire life. And then I was like, oh my God, I can't afford health insurance. Never mind. So, I mean, of course, it was all a pipe dream anyway. So, but there is something to be said for the reduction in that. And part of it is because if you look at that period where health insurance was evolving as it was, we call that sort of period between, World War I and all the way up, it's sort of big corporations, big unions, big government. Everything got bigger. And if you look at entrepreneurial history, the entrepreneur was seen as, in that period of time, as opposed to other periods of history in America where we lionize entrepreneurs, they were seen as eccentric and a little out of mainstream, and the guy that you really wanted to rely on was the corporation man, right? And so even culturally, we had an evolution in the United States of, at that same time, your employer was the person that was going to be helping you take care of your retirement, take care of your health care, take care of these things, yeah. So, and that was just culturally, post-World War II especially, that was very, very ingrained in our culture, in our economy.
First, thank you so much for coming to Gillette to do Saturday University. And my name is Greg Blickery. I'm a representative for District 53 in the middle of Gillette. And somebody that's very interested in the growth of Gillette College for that matter, and in the University of Wyoming having outreach programs in our community. I'm interested in all those sorts of things. The last session, the one about medical care, I would like to point out that from the inside the legislature, when we look at it, I did point out one major reason why we chose to delay, because we just couldn't get answers that we needed to make a decision. And we have a very short time. We don't meet all year. We meet 30 days, or actually 20 days one year and 40 days another year when we're making law for the state of Wyoming. So many of the things that are involved with the Affordable Care Act, we didn't have any answers when we were in the legislature last time. And we still don't have very many answers now. Another problem that we have is because of our low population and our large state, we aren't exactly attractive to a lot of other states to join them. We've tried. Most of them don't want us, to be perfectly blunt about it. So when we look at what we're going to do with medical care in Wyoming, because we have to have a balanced budget by our Constitution, which is the best thing our forefathers ever did, was say that our budget had to be balanced, and that every one of our laws except the budget bill has to be focused on one issue. When we look at that, we have to be really careful about what we're saddling the future of our state with when we look at, it's called Obamacare, but the Affordable Care Act. So we're going to be very careful, just because we have to. And that's part of the reason why that is a major part of the reason why we chose to enter the federal part of this program for now, because we need to delay and learn as much as we can. And we have committees working extremely hard on this issue, and I don't happen to be on that. Representative Kasparic from here is on that committee, and thank her when you see her for her hard work on that committee, because they are working hard and they're doing a lot. She really personally